Now, welcome back to our Line Opinion panelists. We have one final discussion tonight on public health and new threats as we inch closer to winter. Now, according to reporting in the Albuquerque Journal, many hospitals locally are operating above capacity because of an influx of young patients, many sick with RSV. Now, hospitals have held press conferences this week, on Monday specifically, and as we tape this on Thursday, we're waiting on a briefing from the State Health Department later this afternoon, Michael. I know there's a lot of fatigue out there in the last 2+ years about COVID and masking and all this kind of thing. These trends are no joke, especially RSV, 120% capacity, new wings at press for kids. What do we do here? Did having kids in the mix change the conversation about masking in your view?
I wish it would,
Yeah.
but I don't think it's going to.
Okay.
I mean, I think it's good that there's this response because clearly, given what we're presented with, our healthcare system and our citizens, so I think there's a good response, and I think in part it's because of what we've been through since 2019 with COVID. Hopefully we've learned some lessons. Hopefully, we have a better sense of how to respond to this. And
is that what you're seeing out there, though? Are we better at this than we were before?
Well, I think there's a certain segment of our community who understands this and is responding, given the public health protocols and precautions. But again, there are still people out there in the community who deny that there's an issue and are not following protocols.
Right.
But I just think that, and my concern obviously is our whole system. Do we have adequate systems in place and capacity? And this is pointing out that there's still issues of capacity. Mm-hmm. But when you look at rural, reservation, and frontier communities, that's even more. I mean, we think we have problems here in Albuquerque. Those communities, in terms of resources, mm-hmm. I think are doubly challenged. Mm-hmm. And so I'm optimistic that we're responding as well as we can. Yeah. It is, we'll see what we see and how we get through this. Mm-hmm. COVID and the issues that we're facing. I mean, this points out a whole host of issues in terms of, I would say, we really don't have a health system in this country, and COVID demonstrated that we don't. We've not supported and adequately funded public health in terms of federal, state, and local county governments in those agencies. And in the discussion that I referenced in terms of Boston, there's a whole lot of, the Public Health Association was really addressing a whole host of issues across the country in terms of public health officials being threatened, public health officials responding in an appropriate way and coming under political pressure and having to resign or being dismissed. New Mexico, thank God, we've not seen that kind of, I don't believe we've seen that kind of a response here. So I think we're fortunate in that sense.
Good point there. Ed, I mentioned UNM Children's Hospital, 119% over capacity. The medical director at Loveless this week urging parents to teach their children to wash their hands, considering wearing a mask in public places and stay up to date on vaccines, et cetera, et cetera, et cetera. Now, we don't have we don't know what's going to happen in the press conference a little bit later today. I apologize to guess ahead for the folks at home, but we're not going to have a mask mandate. That's not going to happen. We're clearly past that. What can the state say to get people more in tune to what's going on here?
Well, the dynamics of social interaction has changed post-pandemic, right? We can all recall during the pandemic, in my case, I didn't have as much as a sniffle for a year and a half because we were masked up and social distancing and taking all those precautions, and we've since moved away from that. And I think it would be valuable for the state to continue to encourage that through public service announcements, whatever it may take, to encourage individuals to continue to do those things that worked during these mandates. And so what the state can do, again, is up their effort on reminding people the importance of taking those safety protocols. So masking, if you choose to mask, if you choose not to, well, that's fine, that's your choice. But social distancing, washing your hands, things of that sort that are very basic to public health. I mean, we can't forget what we learned, a couple of years ago, right? It still can pay dividends today in the health and safety of our children and even adults. I'm seeing the numbers out there for adults, seniors 65 years and older who are, their RSV are beginning to spike. And we look at it as sort of a child virus, but it's having other ramifications to the broader and older individuals in our
I'm
society.
glad you made that point. It's interesting. It's easy to peg this as just a kid thing, and it's just really not. And Merritt, it's people are being advised to keep their kids home from school or don't go to work yourself if you're the one that's sick as the grown-up. It's easy to say, isn't it? We don't have a system set up to accommodate that.
Oh, no, and I can tell you, I had RSV a couple weeks ago.
Oh, no kidding.
I know. I mean, I do look incredibly young for my age.
Yes, you do.
But I can say 0 stars, do not recommend, do not get RSV. Right. And, I guess kind of went back to some old habits, like I did online grocery store shopping and kept my car closed and popped my trunk. Sure. I didn't go to church. Stayed home. Yep. And one thing I noticed is once, and it took 2 urgent care visits and an online visit to really get it resolved. Once my doctor said I was no longer infectious, I started going back out again. And so one thing I've noticed is everyone's shopping for Thanksgiving. I see about 1 out of 3 people in masks. Yeah. And so I think people are going back to their old habits and they are paying attention. Those who want to. Can we get 100% compliance? No, we're not going to. Are we going to go back to a mask mandate? No, we're not going to. But RSV, because it's just popped up, it doesn't have the drama around it, it's not politicized. Right. I think it's interesting how much more seriously people are taking it because there isn't the stigma or the politics attached to it.
Right. Good point there, too, that last point. Michael, a doctor from Press, told the Journal as part of that story, this immunity gap. I find fascinating. As a public health person, explain what that is. It's so interesting to me and why it's so impactful in RSV right now.
Well, there was an upside to COVID and there's a downside to COVID. The downside to COVID is that people were masking up and taking precautions, but then again, they were not, children and the general population were not being exposed to a variety of things that they ordinarily would, that would have ameliorated some of the what we're seeing now with RSV. Yeah. One quick thing I'd like to say, though, please, relative to an interesting thing that has come out of the Native community, and people may not be aware of this. I don't think most people are, but pre-COVID, American Indians had the highest mortality, morbidity rates of any population in this country, any population, and also had the highest infection rates. The interesting shift in this, though, the flip side of this is that Native populations had the highest immunization rates of any population. And that goes back to something I think which is a tribal historical response to this issue, and that is that the importance of the tribe, the importance of the community, the importance of the group outweighs the individual. And we live in the country we live in today. There's so much discussion about my rights. You can't infringe upon my rights. I'm going to do whatever I want to do. I can do this, I can buy that, and you can't tell me what to do because you're infringing upon my rights. But contrary to that, and I think a more positive response is we have a duty and an obligation to protect each other's. We have a duty and an obligation to protect the tribe. We have a duty and obligation to protect the children. We have a duty and an obligation to take care of our seniors, our elders, because they're important to the community. And somehow, I think there's been a tip in this country where we're out of balance. Failing to recognize, again, going back to the common good, and that we all have a duty and a responsibility, not just for me, but for my neighbor. and for my family and for the community at large. And until we really take that to heart, that it's not just about the individual. I mean, I recognize rights, but it has to be within the confines of a community system, and we all have duty and obligation and responsibility to each other's, not just about you.
That's right. It's a good final word on that topic. We appreciate that. Thanks again to the Line panel as always this week. So good to have you guys here in the studio. Let us know what you think about any of the topics the Line covered on our Facebook, Twitter, or Instagram pages. And catch any episodes you may have missed on our PBS video app or your Roku or Smart TV.